Thank you, Representative Clark. We also have another representative here in our midst, and I'd like to ask him to come up here. Representative Steve Holland, please welcome. Chairman of Public Health.
Oh, just got out of the dentist office. It's not quite that bad, but I did. My karma, I just was walking into my dentist over here and I saw Roy and he said, man, we're having a big healthcare meeting, Mary. And I said, well, good. I'll try to get out of there quickly so I can come and visit. I was in Washington last Wednesday and had the opportunity to visit a couple of our congressional offices and to speak about healthcare. I chair the healthcare committee here in the Mississippi House of Representatives. I've been a member of the legislature for 27 long years, Dr. Shirley. But I've always been at the forefront of Medicaid expansion, so forth. And until I am put in that great sod in Plantersville, Mississippi, I'm going to fight every day for health care for all Mississippians, because that's what it's about. But let me just say, there's a lot of crazy stuff going on in Washington. I found that out. Crazy talk. Diversion from the real issue, from the real meaning of what we're doing with health care reform. And I would encourage you to, hi Doc, I just saw you back there. I would encourage you to call and write your congressman. Now let me tell you, I remember one time a man in Tupelo, he was an alcoholic, had a major drinking problem. And he said, I am really mad because I can't buy whiskey on election day. And I just got elected. That was 27 years ago. And he said, you're my representative. And Kathy, if I told you who it was, you'd know. He's dead and gone now. In heaven, I'm fully convinced, because he was such a jolly old soul. But he said, I want you to introduce a bill to allow the sale of whiskey on election day. Well, you know what he did? He got everybody like to have a nip on election day to call me. And there's power in numbers, and I introduced the bill, and one day I was sitting back at my desk, not listening, and somebody said, well, Holland authored this bill, let him come up and speak for it. It had made it to the floor of the House, and lo and behold, it passed. So there is power in advocacy. Do not, look, now let me tell you about these birds in Washington. They're just like me and you. They put their drawers on one leg at a time in the morning. Just because they're in Washington, don't fear them. Don't be intimidated by them. Call them up and write them and tell them what you think about health care reform. They need to hear from this state. There's too many naysayers in this state. There's not enough of us calling. So we need to get on the phone, call them up, and let them know exactly what we're doing so that we can have health care reform in this state. I'm going to budget here in a few minutes. It's not going to be pretty, but Medicaid, probably more than any other budget, has been protected. And you'll like to know that in the budget that's been released. We did some good things thanks to Mary Truth and her efforts in vocational rehabilitation. And we're doing the best we can. It's hard times, as we all know, but it's something I've learned. God is my Father, and God is all of your fathers. So I figured out a long time ago that makes all of us brothers and sisters. That's what I think. No matter what color your skin is, or how fat or skinny you are, or anything else, it makes us all people with a purpose, no matter how hard the times are. Those things that need to happen from the heart have to continue to happen in this state and in this nation. Healthcare reform is one thing that has to happen. You, more than anybody else, can help make it happen. So write and call your congressman. Have a great day. Have a great life, and pray for the 2010 session of the Mississippi Legislature.
Thank you, Representative Holland. We have Representative Credell Calhoun here today, and we would like to bring him up to the podium now. If you will, please give him a warm welcome.
Good afternoon. It must have been dentist day. I just left the dentist. And I had a root canal, so I'm not feeling the best, but I got out about 15 minutes to 12, and they told me they were having this health rally for the health plan, and I said I got to be there and I got to say something. You know what's amazing to me? I see a lot of people complaining about the health plan that the Senate and the House is trying to pass right now. They're complaining about it. And the ones that are complaining are, a lot of them are going to benefit the most from it. So if they really knew what was going on, I figure they would be on the other side. So let's get them informed. Let's let them know that we are trying to do what's best for everybody, and that's going to benefit this country, in particular Mississippi. We are the most unhealthy people in this country, in this particular state. So do all that you can. But Steve said it best. Let's be active. We have to let our legislators in Washington know that we need health care today. Thank you so very much.
Thank you, Representative Calhoun. I just want to tell you, I've said to these folks many times, they're probably tired of me hearing me saying it. This one is from the heart. This one's not about politics. This is the difference between right and wrong. If you want to be on one side or the other, be on the right side. Be on the right side and be for health care reform. I conclude this session. Thank you for your participation.